Hello and good morning from Bridge Health and Wellbeing. We really do hope that you've managed to have as good an Easter as possible, despite the ongoing corona lockdown and what really is proving to be extremely challenging times for all of us. So we hope you're staying positive and as we've said before, are cherishing the times that you're having with loved ones, family, and people residing with you. I just wanted to chat this morning a little bit about what we're doing with regard to video consultations, especially from a physio point of view. As generally the expectation is of a physio consultation is it to be face to face with some hands on. So how can a physiotherapy session be provided remotely? So I'm going to have a little chat through that now. So we always start any assessment with our information gathering, our question and answer, which is what we call our subjective assessment. And whether the patient is face-to-face or over a video doesn't really make any difference at all from this point of view. So I'll ask questions about symptoms. How did you injure yourself? What's your pain like? What makes it worse? What makes it better? Relevant past medical history. Through this process, we also screen for any serious pathology, which is obviously extremely important because we don't want to overlook those things. And then we'll talk about your drug history. Are you on any medication that might be relevant to why you're presenting with symptoms? And then also your social history, so things around your job, your hobbies. Have you got any events coming up? Once maybe Corona finishes, you're going to do a marathon, or you're trying to do a bit more work in the garden. So giving us a really good idea of what's going on. So that side of it isn't any different at all. The physical examination clearly is slightly different, what we call our objective assessment, because usually we would do it with a hands-on with this process, but it still doesn't stop us doing an assessment. We sometimes have to get the camera set up and tweak all of that. But we can still get you to do range of motion. We can set the camera up and have a look at any bruising, any swelling, that type of thing. We might get you to actually self-palpate a certain area around to give us an idea of how tender an area is, a soft tissue is. We can get you to do special tests. We can get you to do some functional capacity tests, those types of things as well. And that will give us a really good understanding about how you're physically moving, give us an idea of strength, although maybe we can't be really clear on strength, but it will still give us a really good picture as to what's going on. We can then follow that up with some specific exercises which you think might be helpful, and we can work through them as part of the consultation under guidance, lots of cues explaining how we want you to do those. So that can still be done quite beneficially and satisfactorily. And then the biggest part of any assessment is really making sure that we are providing reassurance, we're providing you with knowledge, we're providing you with education, we're educating you around what is pain, how does pain work, how does it manifest, how does it, what we call pain science, how does it change with time, what about soft tissue healing, how long could we expect something to last when you're presenting with a new injury or a pre-existing injury. So that real process of giving you as much information as possible, reassuring you, engaging you as much as possible in the process is really, really important. And again, through a video consultation, that is relatively easy to do because it's us providing you with information, you coming back with a question and us answering that again. The consultation is then followed up with an email, which I will put together to summarise the assessment as we've worked through it. And then I'll also put together a specific home exercise programme, and that's attached to the email. It's usually just on a Word document with some pictures of exercises with some demonstration around that. Sometimes I'll point you towards our YouTube channel as well, which has got some actual videos on there as well. So that's sort of, in a nutshell, what a video consultation looks like. So I hope you found that useful, informative, has maybe given you a bit of an understanding as to what they might feel like, what they might look like. The biggest thing I want you to take away, though, is that we are still trading, in effect. Bridge Health and Wellbeing is still here, and we're here to support you. We're here for you. We're here to help. So even if it's with a bit of a query, I've tweaked my back, what might I do? Just send us an email, so give us a call. We can liaise remotely, and if we really then feel it necessary, then we can look to get you booked in. So I'll leave it there for today. Have a good one.